So have we done our respectable 6 minutes late? I guess we have.
Yeah.
There's,
The restroom, but yeah.
we'll wait for you to come
You don't
back.
have to, it's okay, everything's good.
Hopefully there's a little pizza left. Okay.
I have a million dietary things.
Oh, no, I have blueberries and I have downstairs I could get you. I have,
Okay,
No,
good.
I mean, it
I
is.
have almonds.
Is there any
Not that
phone
much.
pass?
Yeah.
And I bring.
Please.
Yeah.
What do you need?
No, I was gonna say I was gonna wait till after to get pizza. But then it's like if it's gonna be gone, Rex is gonna grab it.
Oh, yeah. I mean, not for nothing, we could always just take you next door, like, they've got the big ugly cornet
I know that was.
next door.
What's the?
The pies that are like this big, so each slice is like this big. Next door, well, not next door, next
So
door,
like-
Cornet.
I used
It's
to
one of the
work-
few places in this neighborhood that's been there for like 40 years, or probably longer, ever since I've worked here.
I don't know how I missed it because I used to work in the sexual health clinic on the
It's-
at 100th Street, but by where the library is. I think it's the library. anymore?
It's like West Side Supermarket. It's not in that building, it's the one just before that.
Wow.
It's not the best made pizza, but it is a lot of pie.
It's true.
All right. Can we wait for Maggie to come back? Yeah. let's wait.
For the intro.
Okay, no, good.
Yeah.
All right, so welcome you guys. This is Dr. Julian Watkins and his team at the New York City Department of Health who have joined us today. I met Dr. Watkins because one of my very best friends is, she does a lot of the outreach media campaigns for health with New York City. And she introduced us and said, hey, you talked about climate change. My friend Allegra knows climate change. So she hooked us up and now we have a nice, hopefully, new line of communication and partnership with the Department of Health at NASA. So welcome.
Thank you. Happy to be here. And welcome to everybody on the Zoom call. We'll hop right into the presentation. The title is Partners in Health, as you can see. Talk a little bit about public health and how we're responding to climate change. In our presentations, we really kind of like to start from the ground level. So offer some definitions, make no assumptions about understanding about what we're talking about. To start, I kind of like to ground folks and kind of share a little bit about who I am. I think it's important when we think about when we're delivering these types of messages, to really think and understand, the types of communities that we all are coming from, that we represent, and really think about what kind of informs the way that we come through the work. So again, I'm an internal medicine doctor by training, trained in University of Miami Hospital in Miami, Florida. And just thinking about, that was probably one of the first times I was really sensitized to climate, just with the rising sea levels during my residency, the first part of in the 2010s. It was just interesting kind of see how that happened and just how vulnerable that community was. Came to New York City, was at working for Columbia, up at the Allen Hospital at the very tip of Manhattan. Was working there in inpatient kind of classic doctory work in the hospital, ICU, everything. And then transitioned to the New York City Department of Health and Mental Hygiene, to the clinic a few blocks down on 100th Street, and really thinking about public health. And at that point, it was like sexual health, with a lot of my work in like HIV advocacy, and just really understanding this landscape. It was 2020, the year 2020, when COVID hit, when I decided to make this transition from just, direct clinical care and thinking about, broader population health, stopped seeing patients and started working on citywide programs to get folks, first to raise awareness, then to get folks vaccinated, and then to talk about this highly politicized intervention of vaccination. And then from there, went on to, really just kind of explore the world of public health, and ended up last year doing a Climate Health Equity Fellowship, sponsored by the Medical Society Consortium for Climate and Health. Basically, it's a year-long program designed to bring in physicians who come from like identities that have been marginalized, to just bring folks into the conversation, to train MDs about the impacts of climate on our health. I think it's really important to kind of understand how how our training formally hasn't really integrated climate. I finished residency, around 10 years ago, but, working with the residents who rotate through, Rex and other folks, we just hear the training is not there, but we know that the impacts of climate change on human health are there. And so that's part of the mission. So we'll go from here. So some of the key definitions that I wanted to share with folks, and really talk about health inequities in this conversation. I think it's important to kind of, often we describe these inequities or these differences between different groups in terms of health outcomes are described as health disparities. But I think it's important to have that distinction. So the disparities bit are these population differences that are and this is like acknowledge the differences. The inequities is acknowledging the structural injustices that are behind the differences. And so the language that we use of inequities really calls in the fact of that injustice has been performed, the injustice is happening, and that I think for us, it kind of really centers us on the action that must be done to undo some of that and to repair. Health equity, the definition that an easy definition is to think about health equity is when no one is kept from reaching their highest level of health because of their social position or social identities. When we think about health equity, the way that we frame it, it's not this end destination. It's actually like a way to approach the work with this equity mindset, and with like a social and kind of racial consciousness of all of these other factors that are impacting human health. When we understand, the social determinants of health, all these factors beyond our biology, beyond our genes that are impacting health, health equity has an awareness of all of these factors, in addition to these, the biological systems that healthcare folks are working with. Wanted to define public health because often when we talk about health and people think that health equals health care, there's been an active process to kind of really medicalize what human health looks like. As someone with a formal kind of medical training, it may seem counterintuitive that we're talking about the fact that not everything is a medical problem. Some of our most pressing issues are actually the social issues. And it's not that folks with our highly specialized training as medical doctors, as public health scientists, or even environmental scientists, it's not that we are excluded from the conversation just because of a specialty, because we're all humans, we all have health. And all of these things are impacting all of us. So public health is basically this art and science of promoting the health of people and their communities. And if you look at the definition that comes from the CDC Foundation, is that they actually don't really call out climate. We really talk about the work that we do with infectious disease. But I think that what this moment is calling us to is to really integrate and really have an eye on the impacts of our environment on human health. So the challenges that are ahead, and defining these things and really understanding that across the globe, communities are increasingly facing intersectional social, political, economic, and environmental challenges that are impacting our health. The vision for public health, moving forward definitely has to include all of these factors, not just, again, the biology. And then medicine and public health, the reality is we have a very limited ability to diagnose and act on these issues that are concerning climate because largely we haven't really seen it as part of our work. A lot of folks, well, if it's outside of the four walls of a clinic, the four walls of our hospital, that's for somebody else. But more and more, there's this need for folks to come at it from this angle as well. So this is a graphic that comes from the CDC to really just as we're thinking about the impact of climate on human health. There's so many different angles and there's so many different ways that climate impacts our health. And for me, as an internist, someone who practices adult medicine, a lot of our work is looking at these complex body systems and understand how they interact. How if one, if something goes wrong in one system, how it can tick something else off in a different part. So really taking this this kind of holistic approach at beyond just like individual patients, but really looking at broad populations and population health. I'm not going to go through all of these, but I think it's just important to kind of understand how when we're thinking about severe weather and air pollution, we hear that and we're making that connection that air pollution equals exacerbated asthma, exacerbated cardiovascular disease. And when we're thinking about the vectors, the rising in vectors, and we think about, the last few years, we've had the highest number of ticks that we found in the city. And even just thinking about the, West Nile virus in New York City, and how we have like this really weird kind of subtropical kind of thing going on where we have a very long, very long summer, and and the tick season is extended. So another way to look at, yes, another way to look at the impacts of climate change on human health. I think often people are thinking about, at the bottom, the ecological determinants, all of these factors like extreme weather, habitat, and biodiversity loss, soil loss, all of these ecological determinants. And we know, we're thinking about health. Yes, we know that the hot weather equals heat-related illness. We know that, the movement of peoples because of the changing habitat or changing, or the changing access to land can cause people to move. We often think about these health systems and, health and healthcare. But what public health does is really kind of looks at these social and structural determinants of health and how we can apply some of these like health systems approaches and some of our training as folks who are, for clinicians, training, dealing with folks like every day on how we can really translate some of that into these bigger things. So think with an eye on housing, and with an eye understanding how the economic impacts of climate and how certain types of livelihood are not we can't really keep those jobs anymore. And how that impacts folks. Reduce equity, education, training, and how things can be and how our systems are disrupted. We saw with COVID how that can happen, but we've also seen, and we can talk a little bit about last summer as well, how climate can disrupt our educations and these other systems. So yeah, just really just thinking about this landscape. So sometimes you'll see in the presentation I may kind of like switch back and forth between like medical doctor, white coat, and a public health hat. I think it's important. As we're thinking about this, one of my primary focuses is about engaging physicians and it's going to get all folks to kind of really see this as part of their purview. So these are the 10 essential public health services, just going to orient folks on the things that we're doing, the things that we think about in public health. There's a lot of words on there, but basically we do a lot of assessment. I think folks are maybe familiar with a lot of that assessment work that we're doing, monitoring the population health, and investigating and diagnosing and really trying to address these issues based on our assessments. We do a lot of policy work, and I think that's where we could definitely where that synergy is to use a lot of the data that comes from the scientists to really translate that into policy. But that policy development is also a lot of that is also like educational policy. So how we're communicating and effectively informing and educating folks. So much of public health, if you think about the COVID pandemic, we started from zero. People had no orientation to what that is, and you think about how all of the work that went into getting us to know what we know now. That is like one of the core functions of public health, and I think the good thing about if we think about one of the good things that came out of the COVID pandemic is this sensitivity and awareness of this system. I think a lot of folks in the general population thinks healthcare. They think hospitals and clinics, but public health. The COVID definitely opened that up so folks understand there's a lot more to it. And then we also do have a lot of the assurances. We're really testing our hypotheses, really trying to respond to the interventions that we've posed and trying to improve upon them, trying to build on them, and really this whole iterative process. And I think that's definitely where we are now. In the dark blue, which I think is an important part of the conversation, is building this diverse and skilled workforce. Now is the time for everyone. It's like all hands on deck time. So really thinking about how we can bring folks in, medical folks, public health folks into the work and really have it be cross-cutting and not so siloed. It's like everybody doing the work. How does climate impact the work that you do? That's kind of where we start versus, well, that's not on my radar. Ooh, it should be on everybody's radar. So grounded us there. And how do I see it? I actually see the local health departments as playing a key role in helping us as a society, as a city, meet the challenges of climate change. We think about these new and expanding public health threats. It's not, we've named like some of our 4 major climate change focuses. We think about rising sea levels, extreme rainfall, heat, etc. But really think about all of the other things that come with it. as I mentioned earlier with vector-borne illness, even thinking about the impacts on the mental health system. These higher temperatures, folks metabolize their medications differently, and how do we sensitize folks in psychiatry to understand that and know maybe in the summer we may actually see folks experiencing what may happen. So yeah, these extreme weather events, flooding, droughts, wildfires, all of these things, they are becoming more frequent, and we need cross-cutting solutions in public health. That's what we do a lot of that. We're convening, we're connecting with folks, doing a lot of listening, a lot of partnership, and just a lot of learning. Trying to like take in how do we actually figure out how can we critically kind of approach what we're trying to do, and then finally even though the public health has taken a hit because of I would say some backlash due to some of the necessary interventions that were made during COVID to protect the overall population health. We still have this public trust. Folks still people want to get the guidance. What is the guidance? What is the evidence? We have this really deep experience in identifying vulnerable populations, projecting disease burden, and I would say, and also translating the burden due to climate. So what can we do? There's a few things that we can do in public health, and then we'll kind of talk through, and then I'll transition the presentation. So really understanding that we can look at this as the work has been going on for a while, but in general, it's pretty new to folks. We're looking at this as we're at the entry level. How do we kind of start from the ground floor? And really make space for folks who may be new to this, maybe just becoming sensitized to this. How do we bring them into this and ease them into this bigger movement that we're trying to build? And really thinking about the health trends and really understand, looking at the data that you all have, how does it translate to human health? And how do we actually talk about it in a way that doesn't necessarily scare people into action? That doesn't really work. In the acute phase, it can, but that's not a long-term sustainable solution. But how do we really, again, call people in and really get folks to be sensitized? Like, this matters to me. We'll talk a little bit about where people are, because there's some encouraging data. Monitoring and inform. I'm sure everyone in this room understands how we can all partner on that. To make this data available, to make this data accessible, to really package it in ways for communities that they understand it. What we found, one of the most important interventions that I would say that came through the COVID pandemic was understanding that we have to really work on our communication. We have to tailor our communication, work with partners to really understand what folks are looking to see and hear, and what resonates with folks, and understand that one size cannot fit all, and we shouldn't try to do that. And that was I think that the brilliance of the community and what folks were able to do to really get messages out and know what this will work for folks. The numbers, the charts and the graphs, they're compelling to many folks who are fluent in that. But some folks, they're not looking for that. They're looking for the human story. They're looking for, what does this mean for me and my kids? What does this mean for my future? And those are the things that we definitely have to really think about to get this message out and to really have folks feel as if this is something that they can put their time and energy behind. Response is a big factor. We do a lot of emergency response, not just COVID. I think that's the thing that people really understand, but we have multiple investigations and emergency responses, from measles to evidence of polio in the water. Like, where do we find that? And just thinking about all these other things. So emergency response is one of the big things that we do as an agency, as this public agency. And some of the work that we've been doing is actually integrating a more all hazards response. So it's not just, is there a viral vector? Is there a bacteria that's resistant to antibiotics? Now we're also understanding that public health emergencies include extreme weather events. And then finally, getting involved, helping folks understand that there's this kind of personal work that folks can do, but also there's bigger work. We've kind of seen how plastic recycling has been, we find out who influenced some of that. And really the call right now is really for folks to really mobilize around these kind of bigger interventions, because we're not going to I think that's a little too much pressure to put on individuals to recycle their way out or, have Stanley Cups to save us. So now we'll just talk about some of the community beliefs, because it's not all bad. Because I think this is one of the most encouraging bits that I found in a lot of the work of the last few years through the fellowship. and the Yale program on climate change and communication. I don't know if you guys are familiar with them, but they're great. And so just want to review some of the data that they're sharing. That again, that is really encouraging. So first, well, actually, before we do that, were there any questions that we want to talk about, like the beginning? We could pause a little bit, take a breath.
I have a quick question on the, like, talking through the disease burden and understanding a little bit more about like the longer term or immediate term burdens associated with certain health issues.
Yeah. So when we're thinking about the burden, we're thinking about the morbidity, right? Like how many humans of X demographic or in X zip code have X diagnosis. Like how many people have COVID? How many people are living with hypertension? We're also tracking like longer term, these cohorts and age groups, like what are the outcomes based on based on folks living with these conditions. So the department, the agency came out with our Healthy NYC report, I would say a few months ago. I don't know, time is a flat circle. Yeah, so we came out with this report a few months ago looking at the loss of life expectancy across New York City that was driven by COVID-19, but not just COVID-19, and really just understanding what COVID-19, but also looking at chronic diseases, looking at the maternal fetal mortality gap, looking at a few of these other kind of severe mental illness, suicidality and other things, how all of that is impacting and what that burden is, and being able to kind of tease it out by like age, race, gender, et cetera. So it's really just like tracking the kind of spot, what is the burden and the morbidity, and then like the kind of longer term, what the mortality outcomes.
Understood.
Yeah.
Thanks.
Quick question on that. Are you looking at the economic impacts of the disease burden at all?
That's something that folks are looking at, because we understand how it's impacted us, and there was a report that we put out in 2021 just looking at the economic impacts of the COVID epidemic. I think this is the most recent example, and just looking at it, how it disproportionately impacted certain communities based on race and ethnicity, but also folks based on socioeconomic status, and even just like region of residence. By zip code. So we do a lot of that, and I think there's a lot of work picking up on that, and even thinking about the economics, like the economic determinants of health. There's a rich discussion on the economic determinants, and even think how reparations for Black or African American folks, what that could actually do to kind of close some of these life expectancy gaps, and how the intervention of literally just meeting basic needs can actually prolong life.
I had a question about, you mentioned the monitoring programs. I know my community board, they always report on West Nile monitoring. She mentioned Lyme disease several times. Does the health department regularly collect ticks to monitor for Lyme disease?
Yeah. So in environmental, I don't know if you're any familiar, but in environmental health, we have like a whole zoonotics department. We have veterinarians who are tracking all of this, like from Lyme disease, rabies, et cetera. So yeah, they are tracking. Yeah. Anybody else? Okay, so now we'll look at some opinions, because it's not all doom and gloom. So this is this study done by the folks in Yale at the Yale Center for Climate Change Communication. They've been tracking this for about 10 years. So just looking at kind of where we are for like our climate opinions, I found it really it's encouraging to see how many folks are actually concerned or actually really do care or are alarmed by the changing climate. And so that's kind of like where we are. This is from the last survey that they did in fall of 2023. But I think more compelling is kind of seeing where we've come. So looking from the left, that's 2013. To the right, you can see in 2023 that a lot more folks feel alarmed. A lot more folks are concerned. Cautious. I think that we're definitely over 50% of folks. It's good to see that we've gotten to the point where over 50% of folks are really are sensitized to climate, to the risk of climate in their lives. We're in an election year. Yesterday was Super Tuesday, and so they also look just based on some of the political determinants. And what we also found is that basically over 50% of the general population, across party lines or political leanings, is concerned or rather considering climate views in their voting. You see certain political affiliations, it's a bit less so, but overall you see it's something that crosses the political spectrum. So it's definitely an issue, a cross-cutting issue that a lot of folks are really concerned about. And depending on some of the questions, particularly that first question about federal funding for farmers are something that I think a lot of folks in the states agree upon. But some of the other things about tax rebates and reliefs and other things for different communities is a little bit more contentious. But overall, across the political spectrum, folks are considering or want to support climate-friendly policies. It's cut up a little bit at the top, but this question is for all of us, for folks in the room. They asked, let me see if I can move this. They asked survey participants if they could choose one question to ask of a global warming or climate expert, what Americans wanted to know most. And the number one question that folks had for folks like you all in the room, well, not everyone's a global warming expert, but for someone in the room, for all of us in the room, is how do you know that global warming is caused mostly by human activities, not natural changes in the environment? That's like the number one. So there's seeds of doubt that have been sown that that humans are responsible to this. But when you look at some of the other questions, I think it is encouraging. Just really asking these questions like, what can the nations of the world do to reduce global warming? So folks are thinking about the action bit. Folks are thinking about, is there even time to act? Like, right? And so, or is it just too late? And then next, what can we in the United States actually do to reduce global warming, and so on and so forth? So I think it's all just a really, again, a really important thing to understand where people's heads are at, what people are thinking, and it can really help us inform our approach. How are we messaging? It can really inform how we want to, like, what types of studies we want to engage in. It's a really powerful and useful tool. So, oh, there we go. So we're pivoting a little bit, and this actually comes from one of our annually the New York City Department of Health releases our I forget the name, our vital stats for the city of New York. So the most recent one came out in February. This data from 2021. And this is kind of the bigger kind of overall life expectancy data. And this kind of heat map that you can see, with the darker areas reflecting lower life expectancy based, at birth. Just to orient folks on the map, these areas circled by the bright blue, these are the areas, our catchment areas for our neighborhood health action centers. The first health action center was founded about 100 years ago after World War I. It was up in East Harlem when East Harlem had a very different demographic makeup, mostly Italian immigrants. But the intervention was to build action centers for a community health center at the time for dental, for childcare, for a lot of other interventions have these centers and all of these resources, vaccinations, et cetera, in communities that need it the most. That model was kind of relaunched about 10 years ago now. So we're in East Harlem. We're in the South Bronx, and we're also in Bed-Stuy, like in central Brooklyn. And if you kind of see where those, which places light up the most, we're definitely where we need to be. And this was all based on a lot of different factors, not climate, but when you look at the maps, I'm sure it's all resonating for everyone in the room. These are some of the data from our environmental health portal. Just looking at housing inequity. The deeper the red, this is where folks are having the most housing problems. You kind of see to the right, you can just see the breakdown by race and ethnicity. Just looking at the folks who are experiencing the most housing problems are identified Black or African American, followed by folks, or like equal with folks who are identified as Hispanic or Latinx. You see the these communities, folks from these communities or of these identities are definitely experiencing more problems than the average New Yorker. And that's something to really consider, especially when we're talking about, being left in the cold or being exposed to the heat. To the left, you can see our heat vulnerability index. That's the same heat map in the same neighborhoods. The deeper the purple, the higher the vulnerability. And those are calculated by, looking at a few different factors. But socioeconomic race and ethnicity are also factors in looking at and calculating vulnerability. And to the right, I think to that point about COVID-19, to the right is actually the 33 neighborhoods that were identified at the very beginning in the COVID pandemic, to identify that by the Task Force for Racial Inclusion and Equity. So when we, after that first wave, when we saw even total, more than 50% of all COVID deaths in New York City occurred in that first wave, and more than 50% of those folks were in these 33 neighborhoods. In neighborhoods impacted. And so looking at the COVID impact, but all of these other chronic disease and socioeconomic status, we were able to identify these communities as places to really focus our attention. And that's where a lot of the work that we've been doing, that our group has been, where we've been in these tree neighborhoods. And I mean, I think it helps that it all tracks with the climate, with folks with climate vulnerability. So as we're, as we're thinking about COVID-19 as this big public health emergency that sensitizes us, as we also understand the context of COVID-19 being, kind of transitioning into this kind of endemic status in the United States with the, with the public health emergency declaration ending, and we see changes. Like, we're thinking about how do we kind of, what's the next conversation? How do we keep this going? And I think this bigger holistic conversation about community resilience, responding to these things, and thinking about resilience as actually, what do we think makes a resilient community? I think a lot of what we're thinking in our Center for Health Equity and Community Wellness is addressing a lot of our chronic illnesses, educating folks on and sensitizing folks to these public health issues that are going on right now. I think that's part of community resilience. So there's all that to say, there's a lot of opportunities for cross-sector collaboration. And again, I really see the role of a health department as climate conveners. At times we will be the experts in the room. At times we will have, a lot to contribute to the conversation. But we're definitely not the only experts in the room. And I love these types of meetings, these convenings, to have folks, cross-disciplinary conversations to really think about and unpack some of these things and really see how we can sync up our efforts. This interest for equity advancement is a thread. It's an expanding thread. And I think it's since COVID-19 also opened up this, portal, if you will, for the ability for us to actually really unpack and understand how things work, and that how things are so interconnected and the intersectionality of it all. And understanding that, those maps, these maps that we're looking at. Sorry. Like these maps, that the COVID map that we saw there is actually represents a lot that has been going on over the last few years. And not just it all didn't start when COVID landed in New York City. So there's a lot of using the public health approach, really centering on assessing for vulnerability, prioritizing risk, at-risk populations, or the populations facing the most risk rather, and really providing engagement opportunities for many sectors. That's what we do best. I think there's so many existing efforts. We're at one point on the ground floor, but there's a big building. There's a lot of work that has been going on. We think about the many entities outside of public health that have been doing this work, thinking about climate adaptation, and working with folks to really understand these increased risks for human health, but this overall willingness to really involve health officials, to really work with hospitals. I think it was last week, the New York Academy of Medicine had a summit, and it was folks from all different parts of across the city and even across the world. One of the speakers came from I think Scotland, Irish background, but came from Scotland, and was just talking about the work that they've done. So it's really there are so many existing efforts. There's a lot of willingness to kind of really get this work going. It's really happy that we're having this New York City conversation and to meet you all. But it's all about strengthening social infrastructure. That's the way that we're approaching it. And when we think about social resilience, like and we're thinking about the ability or the capacity of folks and their systems. We look at people as individuals, but also humans as social animals. We live in families, social groups, and there's really thinking about this kind of bigger kind of community and family structures, how folks can prepare for, how folks can withstand, and then how folks can recover. Because recovery is part of the conversation in public health as well. We think about post-Sandy, what does that look like? We think about this kind of post-COVID, as we're calling it, era. What does that look like, and how do communities recover? Social cohesion is a big part of this, as was mentioned earlier, and really understanding how do we strengthen these relationships, and the sense of connectedness amongst community residents. There are so many different ways that these natural communities form and kind of maintain themselves. How do we come in and help support what naturally is forming versus go in and like create these kind of artificial communities? I think that's a really important question for all of us. And then health equity, I would say, is one of the most essential parts of this. We understand that these challenges are disproportionately affecting communities that have been facing these generational injustices and this range of social and health inequities. The work of health equity has, the language, has the frameworks, and has these kind of time proven ways to intervene and really conceptualize things, looking across, into the environmental justice movement and all these other kind of movements. I think it's a real key part of it, but we have to really center everything with this equity mindset so that communities don't kind of get lost or kind of get like left out in the cold. And then so for short term, we're definitely thinking about connecting residents and each other to local organizations. We'll talk about one of the programs that we're working on. We'll talk about just increasing our community capacity. Again, it's our educational capacity, the capacity for communities to even understand what to do in the event of an emergency, where to turn. And then protection during emergency, what that looks like. Long term, we're thinking about long-term health outcomes. How can we measure the return on investments, these investments to buildings, these upgrades? How do we understand, how do we kind of monitor the fact, how do we translate and prove that what we're doing actually is working? That's one of the key things, especially in equity, in these equity conversations. It's really hard to kind of measure the prevention. It's really hard to kind of model some of this work. So how are we able to capture that using different mechanisms and use different data sources, especially thinking about qualitative? How are we actually able to catch what it means for folks to feel connected, to feel socially connected during an emergency, or to feel prepared when they see the alert and they know, I think one of my dreams is to for folks to think about it like I guess for folks who were around in the 90s, like stop, drop, and roll. How do we make it so easy for folks to know, oh, it's a heat emergency, grab my mask, turn on, close my window. Like, how do we make it so it's just like feels like natural for folks? So speaking of community resilience, just talk about a few of the programs that we have going on. And I'm doing pretty good on time. And I think this is one of the last slides. So the Be a Buddy program, this is one of the newest programs that one of the newer programs in our bureau. The Be a Buddy program was in the Environmental Health Bureau for a few years, and it was basically designed to work with community-based orgs in disproportionately impacted communities, and it's really around around heat safety and heat resilience. So working with community organizations to build lists of folks who are vulnerable, and working with volunteers to just be buddies, to connect to folks in heat emergencies, to check in on folks. This is the list. These are vulnerable folks. Let's call them. What we saw during the COVID pandemic is that folks were able to, with that list, actually activate and call those same folks who they knew were vulnerable to heat, to sensitize them to the fact that COVID was here, to make sure that folks were locked down and actually connect them to resources. And so now after that, after kind of the Be a Buddy kind of original opening and then this response to COVID, there was this conversation between our group and the Center for Health Equity and the folks in environmental. How can we actually expand this? How can we amplify it? And how can we kind of, develop a program to really, again, build neighborhood and community capacity, and actually, expand a little bit just beyond, responding to heat emergencies, but really think about these other major climate change events. Houses of worship, when we think about these naturally occurring networks that are in communities, houses of worship are like kind of the old, kind of tried and true connections that folks kind of go to, these kind of the social, these social settings that folks may feel safe and comfortable and kind of go to. Working with houses of worship to really sensitize them about the needs and responding to climate, from education, but also in the moment of a heat event, knowing that folks in your community may actually need a place for respite. If they are, how can, working with folks to convert, a community center in the church or a fellowship hall, et cetera, into a climate hub. So working with the houses of worship, and then right now we're thinking working with NYCHA conversations about this physical infrastructure project. I'm not very close with that, so I can't speak too much.
I
But
could.
go for it.
Yes, so with the resiliency hub, it's more like Dr. Julian is mentioning that it's looking at design features of what makes up a resiliency hub. So has anyone ever heard the acronym like YO-YO?
Go for it.
You're on your own. You're on your own. That was kind of what everyone was saying after Hurricane Sandy, Hurricane Maria, COVID, and that's the importance of resilience. But, you know, Be a Buddy Houses of Worship, that's more social resilience. The NYCHA project at the moment is looking at like energy systems that can be activated during emergencies, but also throughout the year. You know, what does the backup generator look like? What does it look like when there's no electricity? And then when there's no electricity, how do people communicate that they're okay in terms of Wi-Fi and attachment systems? But also looking at stormwater or, for instance, rainfall. How do we turn that into water when, you know, it's a bit of a Lord of the Flies situation where there's no water bottles in any type of store? So that's more of the design features. But then when looking at it from a health angle, that also has to do with the social features as well. So for instance, like Dr. Julian was mentioning, like what is the mental health recovery look like after disaster? What is that programming like for an adult versus a child? So it's in essence taking into account like all of the physical design in terms of passive or infrastructural, but also looking at the health benefits of a resiliency hub socially. So I don't know if that made any sense, but it's in progress.
Thanks for that. Yeah. And I think that concludes this part of the conversation. And really just wanted to kind of see what folks were thinking. We could talk a little bit more about, you know, some of the bigger hopes and dreams for this climate work. But again, I feel like we're just getting started, and there's like so much opportunity for us to really be imaginative, for us to really move in different directions, and really just call folks in and, you know, start doing work that a lot of us may not have done before, you know, to take on new skill sets, to kind of, you know, put ourselves out there in different ways and kind of work with different folks. So yeah, I'll stop there. Thank you.
We have over 10 minutes left and we can go a little over if we need to. So we can open it up for questions. If you're online, please feel free to unmute yourself to ask a question, or if you want, you can put it in the chat and I'll read it out.
I have a question about air quality. So last summer, people were kind of frustrated after our crazy day that there wasn't more like explicit guidance or planning, like maybe don't drive, stay inside, wear your mask, turn on your HEPA filter. So has New York City developed new plans for how to protect public health if we have wildfires that continue to plague us in some areas of the future?
Yeah, I mean, yes, I think the air quality question, and Kat, what it happened to. I think the air quality question I think it caught everyone by a shock. It took everyone for a shock. You know, like, wait, what is this cloud coming from? You know, Canada? What? But I think it all kind of exposed how vulnerable we are, you know, as a society to these new issues. I think it kind of really was like this very visceral, you know, thing for a lot of folks. So there has been a lot of discussion about what we can do, and just really sensitizing and being better at automating, responding to these types of events. And like what that guidance is. So there's a lot of discussion about what that looks like if it comes again, just in terms of like the recommendations. Luckily, a lot of folks did have masks, you know, at the ready, because of this other public health, you know, ongoing public health crisis. But it definitely kind of really exposed that we really need to like ramp up a lot of this work. And so it's connected to like air quality and a lot of just generally responding to climate events. There's a lot of work in the health department, but then outside of our agency around emergency planning and risk communication. Yeah. Anything
Yes,
else?
yeah, totally,
Yeah.
yeah. I think it's, how do I put this? This isn't like officially Department of Health viewpoint, but I think that wildfire event, it affected everyone in the city. So it wasn't like, so everyone was on point. Everyone had to respond to every single New Yorker in the city. There was not one neighborhood. No, it bothered everyone. So I think that really pushed for people to take action, update the guidance, and then, you know, how do I say this? It was a wake up call to like work more closely with the emergency management department in the Department of Health, but then also with NISM and being sure that, yes, like the fire
New
department
York
was,
City emergency.
excuse me, sorry, emergency management office in New York City, but it's because at the same time, like, yes, the fire department was giving out free masks, but if no one knows about it, what are we doing? So, yeah, I think we're working on that very, very much so, especially now that summer's coming.
Do you ever work with any local radio stations and things like that to make announcements or to put together community forums or that sort of thing?
Yes, we have ongoing relationships with a lot of local radio stations, local news, a lot of these outlets. I think one of the things that COVID has shown, and even a climate emergency has shown, is that we could all do better at our like the different ways that we communicate. It's not enough just to post on social media. It's not enough just to kind of send a push text message. It's like all of the things, and really utilizing like the earned media, is as we kind of call it. And so we do have these relationships, and we really want to push and do better. And that's where the communication bit really is important. What are we saying on the radio? And how do we kind of just normalize folks hearing these types of messaging from folks in public health, from folks in the health sector? That's not just it's an emergency, go hide. How do we kind of normalize getting routinely talking about these things and sensitizing? So it's a combination of both. But yes, we work with local radio stations. There's also an app that folks can put on their phone for their emergency alerts. I don't have the link here, but yeah, there's a lot that we are doing to really think about communication.
I would think Spectrum One News would be a good place for it.
Yeah.
What do you see as the balance between kind of reactive work? So either reacting to the smoke events, reacting to flooding events, reacting to heat events, prepping for better reactions in the future, but then also advocating for policies that will diminish the impacts of such events in the future. So, are you actively involved in the planning for improving drainage, improving cooling centers, making sure that these things are about? So how does your work kind of stack up in terms of like just reacting to something that's happening like this month, this summer, versus planning to minimize impacts of similar events that might happen in the future?
Yeah. It's all of the above, all happening at the same time. Often, these things that are happening in parallel, often they do intersect and overlap. Sometimes they don't. I think some folks have a lane that may work for them, and they should definitely stay in that lane, but there definitely needs some kind of overlap. And so for us, we're thinking about resilience. So it's how we think about prevention, how we think about planning, how we think about sensitivity, like making folks sensitive awareness, but then there is always the response. Understand that public health emergencies can happen at any time. We do a lot of surveillance, and then actually just looking for like what are the other signs. Looking beyond New York City, especially when we think about disease surveillance, we look out and like trends and things that are happening in other parts of the world, because New York City as a major global hub, but also thinking about what it means for climate. So it's a combination of all of these things. And for like the work that we do, because we're like public, we're at this clinical training, kind of public health training, it's really this preventative is the number one, but we also understand that we have to respond in real time to whatever urgent crisis may happen, and then also that recovery bit. How do we actually recover and really work with folks to respond to what folks have been through?
Yeah, there's also an extra layer of complexity in the fact that at the federal level, extreme heat is not a declared disaster. And so if we don't have that ability to get that extra funding, how can we expect church leaders to want to be a cooling center if they can't pay those bills in the first place? So I think there's a lot of legislative work that also needs to be done too. So just my personal opinion coming from FEMA. Yeah.
What do you think about FEMA's overall guidance? Right? So FEMA, like their hazard maps are backward facing rather than forward facing. They don't incorporate projections into what they anticipate to be coming. In fact, they don't even respond to the climate that is right now. You know, they're always like 20 or 30 years behind. So how do you work around that? Can you work around that?
Look, I think the best maps always come from the local level and from centers like yours. I mean, I'm not saying there's no credibility in federal maps, of course, but I think the most accurate information is gonna come from the local level. Yeah,
Yeah.
Do you maintain your own maps?
we do, my team does, yeah, on the data portal. And we also work with Mailman and South Bronx Unite on their air quality monitoring project, so that's more community level. Like,
Oh, what's your portal?
sorry?
You have a specific data portal?
Yes, it's called the Environmental Health Data Portal. He had it on one of the slides.
It's actually just on that portal
Yeah.
the other day.
I have a question about most New York City data portals. They are all maps. Like you go, you want to look at this thing and it shows you a map of New York City broken down by zip code or community board or whatever. But very seldom can you like click on this community and it gives you a time series and how things have changed. And to know if interventions have been efficacious or if there's a trend in like heat stress in a neighborhood, you kind of need the time series. So do you have any movement to do stacking your data so that you can see how things are actually changing and evolving?
I'm gonna tell this to the team because they are always looking for feedback. So I'll ask, hey, you know, Allegra said, what about a time series? Yeah, that's a good point, because then that's more of a tracking of what's going on.
By the way, Gavin Schmidt is the director. Earlier.
Great.
Yeah, we can make that connection, of course. Like I think part of this intro, we'll love to just, make some formal introductions with folks, I think, who you all should meet, we'd love to kind of continue the conversation because we are in this phase now, like, how can we be better with our information? And then also, who's using the portals?
Yeah.
And what we found that our website traffic and a lot of our portals, we have, people actually are turning to the health department, locally to kind of see like where they're getting their information from. We saw that and it's like.
Do you work with Beta NYC? Do you work with the nerdy group of people who like take New York City open data law and try to translate it to the community board level?
I'm sure some folks may. I personally do
It's
not.
like Beta.
Beta
Beta
NYC?
NYC, yeah.
I'm gonna ask Matt.
Yeah. So there's, all of like the hardcore data folks and, like we could definitely, get these questions.
A few hobbyist hardcore data folks. And some paid folks, but a lot of hobbyists.
Okay. I don't. But I mean, I think in COVID, it was helpful to kind of see these other ways that people are presenting the data. Also, what we found like in like our mpox outbreak, when it was like we didn't have this kind of infrastructure for the one specific kind of like new to our system, and like the creativity that came out of folks in the community. But technically,
I mean,
yeah.
I think you didn't do all bad during COVID. Like really quickly, you got your GitHub daily releases of the COVID,
We
and
were using in real time.
Yeah.
I know I was downloading those every day.
Yeah. I mean, it's, I think that we were able to do a lot during COVID, to mobilize a lot of folks and kind of get a lot with the resources and then, and that time we were able to do a lot. And the reality is, public health and I think there's really important work that we do, clearly it's under attack for various reasons. There's like funding, but I think there is this interesting opportunity for a lot like these investments in, responding to climate change, specifically for public health. And how some of the funds that are made available, what we can do to kind of maintain some of the work that we've been able to do and systems that we built during COVID. How can we maintain some of that when COVID funding is drying up? And this is a lot of money for some of these climate interventions.
So thinking about moving forward, oh my God, they're gonna start on our HVAC. You can tell it's a little bit warm in here, right? Do you have like a recommended, like your stop, drop and roll climate resiliency pack? Like what's my acronym for the 5 items that I need in my climate resiliency pack for me personally, or for if I, am a community leader at a church or whatever, like a nail salon, whatever your community is, like what do I have in my pack that I have in case we have this kind of climate stressor?
Yes, so the NICEM, the New York City Emergency Management System, they have they have a few products that folks can use, from like how to make a to-go bag, how to kind of like prepare, like know your local grocery store, et cetera, et cetera. They have that. And we also saw a really good product out of Austin, Texas. They have like a climate preparedness product that was made co-produced with a community group in English and Spanish. And we actually really like that. So we're working with the folks in the Mayor's Office of Environmental Justice. I forget their whole acronym, but we're working with them to kind of make something that is aligned with the Austin, to kind of provide that background for folks to kind of really understand how this is a problem for you, a little bit more educational. So we're working on that. No, we haven't gotten anything to like as great as like stop, drop, and roll. I think it may be like a little bit longer. There's a story, or like a paragraph, but yeah, I feel like we're really thinking about how can we communicate very specifically for these things. And I think heat is a great way for us to really like think about what is the message, and how do we kind of really want to get that there. Refine it, because I think there's a lot of really good opportunities, and other places do it. New York City is not unique that we have these hot days, and I think some places that tend to be hot more regularly, people adjust to their climate, and like they kind of know, and like how, like we're talking with the folks in Austin and folks in Texas and California, like how do y'all do this, and how do y'all how has your, because they've been, I think, responding to heat emergencies and air quality events more frequently, and so really learning from them, like how are y'all doing it. That's been a really illuminating conversation to see what is going on.
So kind of on that topic of what you're actually communicating out to communities in particular events or disasters, are there gaps in knowledge from your side that you need from our side, like from the science? For example, last summer, not really people here at NASA, but Columbia is also associated with the Lamont Doherty Earth Institute. And some people that do aerosol work there focus a lot more on the air quality side. So they were being asked really specific questions that, like, I don't think were super intuitive. So for example, like, can I keep running my air conditioning unit? Like, is that going to be filtering out this particular type of aerosol?
Yeah.
Things like that.
Yeah.
And like, I do aerosol, and even I didn't know the answer to that.
Mhm.
So, are there gaps like that you guys are identifying as like, oh, we need like really specific science answers to these that then we can distill down and communicate?
Yes, there's always something that comes up, and I think that's one of the biggest things, especially like for providers. Folks know that people, and like but people come to their provider, and you would think that folks would know how to talk about this and give the guidance, but people don't. People themselves are like looking to kind of fill those gaps, and these are very practical. Even just like I saw like Seattle health department made like a Instagram post like how to make a box fan air filter for your house, and like practical things like that. Like
Those are still some of the cheapest, best air filters out there. I built several for my children's schools.
see,
Much better than those, whatever, 90s Sharper image catalog, whatever things.
Yeah, I mean,
Hydrostatic, whatever, not hydrostatic, they were static things.
Yeah.
Weird.
Did you have anything?
Yeah, I mean, I was just gonna connect it to like the clinical side of things, like when we're learning about pulmonary disease and like asthma, COPD exacerbations, like we just talk about like environmental pollutants in a very, very broad general sense. Like in my clinic, in my like medical education, there's been no discussion of like PM 2.5, nitrous oxide. Like this is not in most doctors'
Really?
vocabulary. I can fully like straight up say that. Like this is stuff that I have to personally look out like for this kind of information, and I'd like to take this information back and develop curricula, but yeah, it's non-existent right now.
Maybe like a pulmonary specialist may be able to get that somewhere.
Deep into
Well, like I was asking about the local law 97, and the reason I was asking that is like gas stoves are apparently leaking all the time. And like, it's not something you get a mask would help you with. It's like the NOx coming out. And like 18% of New York State asthma cases can be tracked back to like this decision that we would have gas in our houses.
A lot of opportunities for us to really change some things and kind of like shuffle the deck a little bit. Like, what have we been doing, and how do we understand that like right now we need a bit of change, like how we do things, how we're approaching problems. And like this climate thing is like all of us are in it. And I think you all with, with your expertise are, I think, positioned in a very particular way, and, really excited, for the willingness to connect. But I think the thing is like how to like really thinking about that human bit, like how do we like there's like these so many of these practical things like on the ground that people are thinking about, and like how do we kind of like build bodies of evidence to kind of speak to that or kind of like highlight, highlight that those interventions are the thing that will draw people more in. Like some people actually don't care about some of like the bigger kind of projections. Some people just care like I have my 2 kids and
Yeah.
how do I manage, So we're thinking about that, and it's like the whole range.
When you made your point, it made me think like, definitely during the fire, wear your mask because it will filter the PM, but a lot of the really nasty stuff that we don't, I mean, what's in a fire because you've measured for it, but there can be all kinds of compounds that are produced during fires. We found that out during 9/11, like all kinds of crazy things being produced.
Yeah.
That your mask, I mean, they're not aerosols, they are like gaseous, and so the mask is not doing you a heck of a lot of good.
Yeah, I think,
Scary.
I'm sure from your perspective, there's probably has to be a balance between just fear mongering. Like,
Yeah.
the specific aerosol I study comes from smoke, and like technically part of it is carcinogenic. But like, I don't know to what extent, and it's impossible for scientists to tell you how much is in one aerosol that you're exposed to. So I'm assuming you guys have to kind of reach a balance of like communicating all the risks that might exist with an event versus what people are actually going to be facing and or what they can respond to.
Yeah.
Cause like you're not gonna flee the city for a single day, like you just might not have the opportunity to. So it's like, okay, realistically, what is effective to communicate to people and what do people, I guess, need, deserve? I imagine those are hard decisions.
It seems like super important to get like in the medical training though, because like for vaccine denialist people, apparently having that one-on-one conversation with your primary care person is the most effective style of communication, not just the branding from like your New York City public health or your federal public health people, but it's like the person who's like nursed you through sicknesses for the last decade. That's the person you actually might believe and listen to.
I think it touches both, but if you're a New York City physician, you also are a New York City resident, and just making those types of conversations normalized,
Yeah.
I think that goes and it helps to kind of create those types of linkages. And so, because you'll say, hey, this is something we need to learn about and add it to our curriculum, please.
I think the other big dream is like even to one day, mark my words, one day you walk into your doctor's office, at one point they'll be asking you these climate questions, and it will not feel out of the blue. It should be a standard intake. It used to be a time where you couldn't talk about sexual history to people. People would like walk out the room. And so really thinking about how do we kind of understand that these things are plastic and dynamic, and as we know better, how do we kind of like do better and integrate this knowledge that we are amassing and know that I think that physician encounter, that first kind of intake, like that could be the thing that sends, oh, you're asking, why are you asking me this? And then, that's the opening, that's your opening. You'd be like, well, we know some folks in this neighborhood, and then there, and it's real to them. It's not ice caps and polar bears. It's like, it's my block. It's, it's the other, it's across town. Like, really? My outcomes are different than someone literally on the other side of the park from me? And that's a conversation that I think folks appreciate, because that's like this practical kind of like how this thing is playing out right here.
Question about the whole situation and are you reflecting that, and is there like a change in mental health in response to like climate change and extreme weather events? Definitely we see that.
Yeah, there's definitely there's a couple things, and those opinion poll, the opinions out of Yale, they really kind of go there. There's a lot of folks who are experiencing climate fatalism. There's a lot of folks who are feeling who have like changed behavior because of their fear of like how climate will impact folks, and they track based on race, ethnicity, age, all of these things. That's something. I'm also young folks. I think understanding a lot of younger people are experiencing this kind of climate fatalism, and like depression, anxiety. All of these things are linked to the changing environment, and so that's like a real thing too. So it's not even that we can like passively like, oh well, maybe think about it in the summer, because people are, we're seeing that it's increasing in combination with the whole rest of the mental health crisis that's going on in our city. Yeah.
Something else like that we haven't talked about, thinking mental health crisis and climate change. I had an interesting speaker about a year and a half ago who was talking about nighttime temperatures. And his research was looking at, I think every time you're over 12 degrees Celsius, like 50 Fahrenheit, at nighttime, like there is a demonstrable decrease in the number of hours of sleep that you get per night, which translates into all kinds of things, including mental health and like attention and tolerance and all kinds of.
Yeah, wow, we do have that seminar recorded, I think it
Yeah,
might be.
I remember I want to say his name was Nick, but I'm so bad with names. You see I'm bad with names, I'm sorry.
That's so interesting. Yeah, if I find it, I can also link that to you guys. I'm sure it's not a surprise to you, but
Nice to meet you.
But those are the
That was
sorts
kind
of
of my
things.
teeth, yeah. Kind of more of a data nerd approach, like you were talking about earlier, someone that was using all the available info they could
Mhm.
to try to pull out these patterns
Yeah.
of nighttime temperature and then health and mental health impacts.
Yeah, Beta NYC, they are, I mean, I think it's more formalized than I made it out to be before. You should definitely check it out.
I'm gonna investigate this.
No, I think that's fascinating. I think those are some of the things that the community, they appreciate learning about, because people would just, you're not cognizant, but you know something's happening. And then sometimes if you just say, this is what could exist, people are like, oh, wow, thank you. Because now you've given me an explanation for what I'm feeling and what I know what I'm going through.
Yeah.
And it's just the nuance and how you connect the community to the details.
Yeah. Well, makes me, like, the nighttime thing makes me think, like, we have cooling centers. Well, I don't even know, like, now that my library is closed on the weekends, will the cooling center also get closed? And if I have this question, and I'm pretty well plugged in, like, surely everyone else has this question too.
Especially as we're cutting funding for
Yeah.
libraries and other public
Yeah.
spaces.
Yeah.
Mhm.
But it makes me think, like, for the nighttime temperature thing, like, New York City used to have the program where, didn't we just used to mail people air conditioning units so they could just at least have a respite room? Do we still have this program?
Yes. Starts a couple weeks earlier this year, just because they saw the demand.
Yeah.
The demand is high, and then that the high temperatures, when they start, they scoot it up.
Mhm.
So we do have that program. There's also like an assistance to kind of to pay utilities, which I think is a very important part of it too, when we're thinking about the equity. Yeah.
And the cooling centers, that's fascinating because I used to operate cooling centers and it's staffing.
Mhm.
It's
Yeah.
staffing and cutting down on certain,
Right.
they used to, let's say you had a cooling center to incentivize people to go, you could provide food and snacks, and funding shifted and there's no longer food and snacks. And then if you're in a space, you're leaving your home, you get to the cooling center and you get there and you can't eat and/or hydrate the way you need to with your families. But these are all community conversations,
Yeah.
like things that messaging and
Yeah.
that we're working to do better with the health department.
Also think about not just like the air conditioning cooling system, but the passive ones. Like the biggest city program I can think of is like the fire department. They have their little like nozzle thing, the spray, but sometimes the cars get confused. They think that's their car wash. But that's like that passive community, the cooling capacity of the communities, I think is super important. And I noticed like you work in Allen, that's my local hospital actually. But when you go to Inwood Hill Park, this playgrounds, which you're not allowed to be in if you're over 14, they have that passive cooling capacity, right? They have the spray nozzles, but there's not any place you can get to as an adult.
Well,
And,
it's sprayed.
but if you go up to Van Cortlandt Park, listen, Van Cortlandt Park, actually around Van Cortlandt Park, they started putting these like posts,
Mhm.
and they have like just like water sprayers on posts around Van Cortlandt Park. And the first time I saw it, this is like a really, really great way to have like passive cooling around the neighborhood. And this is kind of like bespoke looking like,
Yeah.
like 4x4 things, but can we get this like every water fountain in New York City? Can it also have like a spray nozzle where it could also be like a cooling, even if the power goes out, you still have cooling capacity in your neighborhood?
There is the spray caps program, which is run by the fire department through emergency management agency. And so you call them and then they put the specific cap on a fire hydrant so that not too much water comes out at the same
So
time.
exactly. This is a great program.
Totally great.
I love this program a lot. It's just the cars, they do get confused. That's their space. Yes.
And folks don't know too. Like I moved here 15 years ago, it was bizarre to me, like a bizarre concept. I'm like, why the fire hydrant? And but it took someone who was like who lived here long enough to kind of explain to me the relevance and the importance of it. Cause it was an inconvenience. I'm like trying to drive down, my car's getting sprayed. I'm like, what is this? But, to connect the dots, and then people want that and they want to find out about it. And then the flyers show up, and then the people are twittering, talking about it. And it enhances the community where that knowledge might not have been known previously. Yeah.
I don't wanna cut this off, but it's 2:15, so we've gone a little bit
Done
over.
well.
I think I'll stop the meeting, I'll stop the recording, so if we can give another round of applause. Thank you so much.
Thank you. Thanks for having us.
Really glad that you guys came today. I would love to just like